Developments in technology are revolutionising medical care and surgical procedures across the globe. Proximie uses live augmented reality technology on its platform, allowing clinicians to virtually transport themselves into another hospital to collaborate with local teams, ensuring patients always receive the very best care. Sharon Thomas went along to a busy London A&E to see this technology in action.
So maybe I should show you my card.
This is Janet Inman. Unfortunately for Janet, she fell down the stairs at home a couple of days ago and broke her finger and her collarbone. Today she's come here to her local hospital for an initial consultation. But the specialist surgeon leading Janet's treatment is based at another hospital 15 miles from here.
We're going to get Tim, the surgeon from Chelsea Westminster Hospital, to collaborate with me on a consultation using the Proximie platform.
This small tablet hosts the Proximie platform, which enables a clinician at one hospital to visually and practically collaborate with a specialist based at another, which could be in a different part of London, as in this case, or on the other side of the world.
Wonderful technology, isn't it? And it saved me going up to Chelsea and Westminster, which would be a bit of a trek as my shoulder's quite painful and my finger. But no, I'm grateful that I could come locally.
Essentially, it allows a clinician to virtually transport him or herself to any clinical setting to engage in a consultation, assessment and/or support the delivery of care locally.
We're going to bring her hand, her right hand, under the examination camera. Can you see it?
Proximie is clinician-led. The augmented reality system means it can be deployed in almost any healthcare setting, from a major teaching hospital to a small clinic. It was originally used in war zones where local expertise is not always available and can be life-saving. It's hands-on, virtual assistance.
Can you see my hand now? What we're looking to assess is that when you normally go to make a fist, all your fingers line up. Because of where the fracture is just here, her fingers out to the side.
The specialist surgeon here, Tim Halsey, is able to mark on the screen which specific area will be operated on. The method is also an enormously helpful teaching tool for medical students.
So I think that where this really does have a lot of benefit is with teaching. So the potential for a patient to have an operation that I can then talk through what I'm doing to an audience of medical students. There are issues with the number of people you can have in an operating theatre because that has an influence on the air sterility. So what we try and do in theatres is to minimise the number of people in theatre, but that potentially restricts the teaching experience or the learning experience. So if we can have a relatively large audience through using this technology, then it enables the medical students or the junior doctors or people who are trying to find out more about hand surgery to learn more about what we're doing without having to physically come into our operating theatre.
It's the brainchild of a surgeon who believes everyone should benefit from improvements in healthcare technology and is currently being used across 5 continents in some of the leading institutions. It is simple, practical and powerful.
At the core of Proximie, we're clinician-driven, and as clinicians we're seeing firsthand the problems that we're facing, that there's a mismatch between supply and demand, and what it really boils down to is a resource shortage. There just aren't enough doctors to deliver the care at every single site. And so we're looking at ways to leverage technology to force multiply the expertise that we have across the country, to make sure that every patient can get the best care the first time, every time, no matter where they are.
I think these kind of innovations are really exciting. They provide good quality clinical care close to home for patients, so keeping them local where we possibly can, and also best value for the NHS, best use of resources, more efficient care.
Back at West Middlesex University Hospital, it's clear that enabling frontline clinicians to get the specialist opinions of those not on site is invaluable.
It was incredibly helpful today having a specialist surgeon collaborate with me. Felt their presence with their hands, guiding my hands, helping me with the consultation and really ensuring that I'm getting the right opinion at the right time for the patient.
I think it was excellent actually because I was looked after so well and it was so not complicated. I'm in quite a bit of pain and it was nice to be able to come to my local hospital.
Proximie, local where possible and centralised where necessary.